Welcome, I'm Kylie Gates-Barrett. Today on NBC25 Health Special, we're taking an inspiring look at the people and programs making a real impact on our community's health and well-being. We'll begin with Genesee Health Systems, where a new crisis response model is offering immediate help and safe supportive spaces for those in behavioral health emergencies. Then we'll ride along with Patriot Ambulance Service to see how they're combining advanced training and compassion on every call, while also supporting the mental health of their EMS teams. Next, meet Tara and Darci from Serenity House Communities, two passionate voices leading the charge in Flint's fight against addiction, trauma, and stigma. From peer recovery coaching to motherhood support and post-overdose outreach, they're redefining what it means to walk with someone on the road to healing. And finally, we'll step into Blue Sky Therapy Services in Davison, where innovative tools and integrative therapies are helping patients regain strength, confidence, and independence. It's all ahead. Real people, real care, and real stories right here on NBC25 Health Special. Our first stop takes us to Health Source Saginaw, where innovation meets recovery. Whether it's overcoming the effects of a stroke, managing Parkinson's, or tackling chronic pain, their team is using advanced therapies and cutting-edge technology to improve quality of life. From smart gloves and underwater treadmills to specialized treatments like dry needling and lymphedema therapy, they're helping patients move better, feel better, and live stronger. Let's take a closer look.
Health Source Saginaw Medical Rehabilitation Center includes outpatient physical, occupational, and speech therapy services using leading technology and innovative therapy techniques. Lymphedema affects 1 in every 1,000 people in the United States, resulting in chronic swelling of the arms and legs. Certified lymphedema therapists trained to complete decongestive therapy use a manual and compression wrapping technique, decreasing swelling, improving quality of life, and enhancing long-term function. The Smart Glove is a biofeedback device allowing communication with computer software during functional movements aimed at improving range of motion, sensory perception, visual neglect, and coordination. The Smart Glove measures for functional gain in patients suffering chronic and acute orthopedic and neurologic injuries. PT, OT, and SLP therapists use functional electrical stimulation systems designed for those with neurological conditions that affect hand, leg, foot, face, and swallow functions, most often following a stroke. An electrical current stimulates motor nerves, causing neural re-education of the muscles to contract for improved overall movement. Health Source Saginaw offers LSVT Big and Loud Parkinson's disease treatment. PT and OT perform training in big movements focused on increasing range of motion, improving balance, and the recalibration of the sensory motor system. The SLP supports the Parkinson's program with LSVT Loud, the recalibration of voice and communication, increasing loudness, intelligibility, and facial expression. Interactive metronome is used to synchronize a range of body movements to a beat. Real-time auditory feedback for reaction time with each response signals if the response was too fast, slow, or right on. This leads to better internal timing and synchronization of the brain, shown to improve attention, self-regulation, planning, and sensory motor skills. For those community members who have history of stroke, traumatic brain injury, or other neurological changes that come with age, SLPs use a pre-driving skills simulator to assess visual processing and scanning for coordinated eye and hand steering movements and leg and foot pedal movements, memory, planning, safety awareness, and the understanding of traffic rules while avoiding potential hazards. Dry needling is performed by a physical therapist using an acupuncture needle, inserted into specific points in muscles, joints, and tendons to activate the body's anti-inflammatory system. This technique decreases chronic pain for those where other medical management is not an option. Pelvic floor therapy targets pelvic pain, chronic hip pain, or low back pain in those with a history of childbirth or abdominal surgery. Our licensed physical therapists assess the core muscles contributing to pelvic floor function and design a treatment plan to address any underlying issues to strengthen the core. Aquatic therapy, used to treat patients with lower body pain, difficulty with walking, weight-bearing restrictions, or inability to stand or walk in the home. With our high-low platform, we can set the perfect depth, turn on cameras to see how the body is moving. Our underwater treadmill allows athletes to get back to sports faster than ever, as well as maintain their conditioning level while resting in an acute injury. At HealthSource, we're excited to help you on your journey to recovery and look forward to welcoming you to our family.
Our next stop takes us behind the scenes of Patriot Ambulance Service, where saving life starts with compassion, training, and teamwork. From a strong focus on mental health and employee support, Patriot is reshaping what it means to serve in emergency medical care. Whether it's a call for help or a call for a new career, their mission is clear: care for the community and care for each other. Let's take a closer look at Patriot Ambulance.
So how our crews respond to emergencies in this county is going to be, it's set up through 911 for them to respond. They will send the closest ambulance to a medical emergency. When our crews arrive on scene, the first thing they try and do is calm the scene down, assess the scene, and look for any patients that are going to be the most injured or the critically ill patient. We work very hard in our training through American Training Institute and ongoing training to ensure that they understand they're not just there to treat injuries and treat illnesses, but they're also there to ensure that the family understands we're going to take good care of their loved ones, and we're going to do everything we can possibly do to get them to the hospital safe and in a timely manner.
Hi, I'm Sarah Doobie, Vice President of Operations at Patriot Ambulance Service. So at Patriot Ambulance, we take mental health very seriously. It's a high stress job, so we utilize a lot of different avenues. We have apps that we use so that the employee and the family, they can reach out to counselors, and they're available with tips so that they can work through stressful situations. We also have a very good leadership team, open door policy, come on in, let's chat about it. It's a great thing for the employees because they feel like they have a welcome leadership team to be able to talk through things. We do a lot of events with our employees just to take away from the stress and just decompress out of work. We're a family here, and that's what's really important. We also reach out to other services so that in high stress and critical situations, they're there for us, and we're able to really lean on them, and it's done great for our employees and their mental health.
There's been an EMS profession shortage for the last 8 to 10 years, progressively getting worse since COVID. We recognized it as a company in 2021, and we realized we needed to do something to try and get more people interested in this career. That's the time when we started American Training Institute. We're very proud of the work that we're doing there, training EMTs and paramedics on a daily basis. We've got the Earn While You Learn program. We will actually bring a person in, pay them while they're going to school, get them through the training, and then they are out on the road in about a 12-week turnaround. That has helped out a lot with the local area and getting EMS professionals on the road and trained so they can take care of the community. And if you're interested in joining our team, please reach out to us at 810-742-5391 and ask for somebody in the talent management department, or you can go on patriotambulance.net and click on the careers page, and there will be an application if you're interested in becoming the next EMT.
Next, we head to the American Training Institute, where the mission is simple: train the next generation of EMS professionals and empower the entire community with life-saving knowledge. From fast-track EMT programs to hands-on CPR courses for schools, offices, and churches, ATI is filling critical gaps in healthcare and emergency response. With experienced instructors and strong local partnerships, they're shaping confident responders ready to make a difference. Here's how they're doing it.
My name is Dominic Foster. I'm the VP of Clinical Education and Quality here at American Training Institute. So in EMS, Emergency Medical Services, we offer a variety of classes for students to enter into EMS. Usually they start off at the EMT level, which is the Emergency Medical Technician level. Once they get into that, they can progress on to the paramedic level with an additional 16 months of education. EMT classes are really vital to the community because, as you know, there's a big shortage in healthcare, in ambulance services and other agencies that provide EMS support to the community. We work with a variety of sources. Our number one source is Patriot Ambulance Service. They offer a lot of scholarships out there for students to enter into the EMS workforce. We also partner with other agencies like Michigan Works and Greater Flint Health Coalition. Once they enter into the EMT class, it's a 10-week academy-style course. We do clinicals with the ambulance services, and students kind of fast-track in to begin their career into EMS. ATI does a whole host of classes for the community. In addition to EMS initial education training, We offer CPR classes, first aid. We work with agencies that have swimming pools to train their staff, their lifeguards, how to do first aid, CPR, how to use an AED, because overall health in the community is vitally important. We want to make sure that we're not just teaching just the EMS type courses, we're teaching a full community-based education service. As I mentioned before, the American Heart Association's Heart Saver course is a broad spectrum course for the community. Different groups like offices and manufacturing plants and schools, it's kind of a customized, what do you need, what's really important for you and what's important for your audience. Because at the end of the day, the community needs to be serviced first, and a well-trained community specifically designed for an office or a manufacturing plant or a church is key. Every course has a strong component of CPR, AED use. There's been multiple cases where we have had students at a school that have had a heart defect that was unknown. They collapse on the football field or the basketball court or playing volleyball, and AED use and community CPR really is the key for saving these lives of these co-workers, these people that you live next door to, your neighbors, classmates, that sort of thing. So our big push is to get as much information as possible on how to use an AED, how to start CPR, what to do in an emergency. Here at ATI, we have a full-time staff of 6 educators and staff members, with the combined experience level of 125, 130 years of experience. All of our instructors have worked the road as paramedics, and we believe that that level of experience translates into good instructors. They can relate to the students, what they're going through. They've done that, they've been there, they were students, they've done clinicals and ride times and worked in the hospital. And having that experience level is just really important for us. We're very proud of it, and we think that translates into good pass rates for students and makes them good clinicians once they get into the EMS field. At ATI, we have several partnerships, as I mentioned before. We do a lot of training for local agencies. We work with the Sheriff's Department, we work with Bishop Airport, hospital contracts to teach for there. We believe that those agencies have come to us because they want the best, highest quality education that we provide, and we strive really hard to make sure that we have the most up-to-date information. We believe that that experience level of our education staff, coupled with the most current information and these strong partnerships, really translates across the whole county. It's not just the community or one ambulance service, it covers just the entire county, and we're really proud to have those partnerships and excited to keep those partnerships continuing into the next year. If you want to contact us for EMS classes, whether it's initial education for EMS or advanced courses like ACLS or CPR, you can contact American Training Institute. Our website is www.americantraining.net. Our phone number is 810-600-9155.
Our journey continues at CMU Health, where compassionate pediatric care meets cutting-edge education and mental health support. From newborns to young adults, their team is committed to walking alongside families every step of the way, providing everything from general care to specialized services like pediatric neurology and psychiatry. With a growing residency program and a focus on the mental wellness of today's youth, CMU Health is shaping both future doctors and healthier futures for our kids. Here's a look inside.
As pediatricians, we pride ourselves in caring for families and kids and having that personal touch, I guess. That's why we become pediatricians. We love seeing those kids go from birth and being newborns until they're new in the world, coming out of high school and going to college or pursuing other things into the world. The thing that makes us different, we now are in teamwork with CMU College of Medicine and also with the new residency program through CMU for pediatricians. We've just added neurology to our group, who are now seeing patients. On the next 6 to 9 months, we'll be adding pediatric endocrinology and pediatric infectious disease. We already have pediatric rheumatology with one of our pediatricians, Dr. Mary Moore. So as a result of that, we've been recruiting and growing with a goal to become a complete multifaceted pediatric center and a teaching center. And so as a result, we've recruited 3 new physicians other than myself in the last year, all who have a role in our teaching program, which means that we are passionate about not only caring for your children and become a part of your family in that way, but practicing evidence-based medicine so that we can give you the most and updated care, but also we have a passion for teaching that to the next generation of physicians. And you're also going to see an environment where people get along, people enjoy each other, and enjoy your family while we're at it. I think right now a very hot topic in pediatrics is how mental health is affecting our children at all ages, and especially through adolescence. I think with all the transition and change in our world and our community today, and some of the challenges they face with social media, that we've seen a rise in the last 25 years that I've practiced in concerns with anxiety and depression and mental health needs for our children.
Some of the noticeable signs that the child may be experiencing a mental health crisis include their ability to participate in their activities that they once loved, more isolative behaviors, staying in their rooms for prolonged periods of time, not engaging with their loved ones, failure to sort of immerse themselves into hobbies or activities that they once did, in a very comfortable or habitual way. Their academic performance in schools, for example, if you notice that that's been deteriorating, or their engagement with activities with their friends, with their social support groups. I think these would all qualify as concerning signs. CMU has a range of resources to help children and families experiencing mental health problems. We have a robust outpatient team that includes psychiatrists, it includes social workers, it includes mid-level providers like nurse practitioners, it includes clinical psychologists, and we also have collaborative relationships with the larger community, including community mental health. So we're able to put together pieces and address the whole individual as opposed to just parts of the individual. We also have a partnership with HealthSource in Saginaw to help families and children who are going through more acute crises episodes to help with inpatient psychiatric care. It is really important to seek early intervention because it can make a world of a difference. During that journey, you will need a team that is supportive and with you all the way. To learn more information, you can find us at cmuhealth.org.
When a crisis happens, help can't wait, and Genesee Health System is stepping up to expand services to meet those critical moments head on. Whether it's someone to call, someone to respond, or a safe place to go, GHS is making support more accessible than ever. From 24/7 mobile crisis teams to a brand new stabilization unit, this is care that's immediate, inclusive, and close to home. Let's take a look at how Genesee Health System is transforming crisis response.
GHS is really excited to expand our services in the area of crisis. We're going to have three main components: someone to call, someone to respond, and somewhere safe to go. With someone to call, you can call our customer service line at 810-257-3740, and a crisis line is available 24/7. Very soon we will have tech support available as well for those who prefer that. When we think about someone to respond, Genesee Health System has mobile crisis services available 24/7, 365 to support people in our community that are experiencing a behavioral health or substance use crisis. That service is available to anyone in our community. We say if your feet are in Genesee, we're here to serve you. When we think about somewhere safe to go, our crisis continuum will now include a residential portion. We want people to feel safe in the environment that feels like home. So rather than waiting in the ER, or sometimes we see cases diverted to jail, Genesee Health System will now have a crisis stabilization unit, which can house people's safety for up to 72 hours. We will also have a residential unit where individuals can stay up to 14 days, making the total stay here, if needed, up to 17 days. The impact and expansion will really help Genesee County have the services we need at the time we need them. If we can all think about our worst day, where we're not feeling like ourselves, when we really need some support, we don't want to wait until Monday or till next week. This support is available right here, right now, at the time you're experiencing the crisis. The state of Michigan kicked off this pilot, and we joined in right away, wanting to be part of this really incredible evolution. And so Genesee Health System will be the third in the state of Michigan to open this type of unit. We want our community to know that we are here to support them. Historically, not all services were available to everyone. This is different. The behavioral health urgent care, our mobile crisis team, our crisis line, all of those services are here for everyone, regardless of age, insurance, or level of need. The new location will be at 1040 West Bristol Road in Flint, and we will be joining the main campus of Genesee Health System. Regardless what type of crisis you're experiencing, this support is here for you. I'm looking forward to having services available when it's needed the most. We know that we see better outcomes for individuals when they're able to have that support at the time of need. So we really look forward to helping people come in, receive the service in a short amount of time feel better, get back to their life, go to work, go to school, enjoy your couch with your favorite cup of tea. We want to avoid those long needs for treatment. We want to avoid needing to go to a hospital. Come here right in your community where you can feel safe and whole, and we'll provide really rich treatment on the spot. If you're thinking about supporting a family or a friend and encouraging them to move forward with mental health treatment or substance abuse treatment, you can call us and we'll be more than willing to talk you through that or bring them up here. Sometimes it feels really scary to think about mental health treatment, and part of the way that we can break that stigma is to come on site. Come check out our new building, come check out our welcome center. Mental health has changed a lot in the last 50 years. It doesn't need to be something that we're afraid of anymore, and we all have mental health. So really just getting your feet here and seeing that it's a great, comfortable place to be, I think you'll feel a lot more comfortable. The Behavioral Health Urgent Care will offer 24/7 services and move to this location in late spring.
Our next stop takes us to Blue Sky Therapy Services in Davison, where personalized care meets advanced rehabilitation. In a warm, home-like setting, their expert team provides everything from physical and speech therapy to specialized massage treatments like cupping and myofascial release. They're also the only clinic in the area offering BITS, an innovative cognitive therapy system that boosts brain and body coordination. Let's step inside Blue Sky and see how they're helping patients take back their independence.
My name is Darren Novak. I'm the lead physical therapist and owner of Blue Sky Therapy Services. We treat a variety of conditions such as sports injuries, orthopedic rehab, post-surgical recovery, neurological problems, and spinal cord conditions. We are a small hometown clinic that provides hands-on therapy along with exercises. Even though we've seen patients with the same problem or issues, we have to treat each patient differently depending on how they respond.
My name's Kathy Ellis. I'm a physical therapy assistant. I've been at Blue Sky for just over 5 years, about 5.5 years. I've been doing this for 31 years. I think the big thing here for us is we are one-on-one, develop a rapport with them. Basically, I ask them what's aching them. We have a BITS program. They use it for hand-eye coordination. You can do driving assessments.
We are the only clinic in Genesee County that offers the BITS program. The goal of the BITS program is to help clients transition from hospital or rehab settings back to community living, work, or school by improving functional independence.
My name's Michelle Barassa. I am the lead massage therapist for Blue Sky Therapy. I have been since 2017. I typically work with Darren and Kathy's patients. 99% of the time, most people do need massage therapy. Each patient is going to require a different modality, a different approach to massage. Truly, that is just designed according to each patient and try to customize their plan according to what they need. Call your doctor, get a script, have the doctor fax it, or you can walk it in to our clinic. Myself or Kathy are the first two people you'll see at the front desk, and then we take it from there.
Our address is 3058 North State Road. We are between Richfield and Davison Roads on N15.
Our journey continues at Serenity House Communities in Flint, where recovery goes beyond sobriety. It's about healing mind, body, and spirit. From peer-led coaching to holistic therapies like acupuncture and Reiki, Serenity House is creating a safe, judgment-free space for those facing addiction, trauma, and codependency. With free services, transportation help, and even sober social events, they're building a powerful, compassionate path forward. Let's take a closer look.
My name is Tara Moreno-Wallen, and I'm the Chief Executive Officer of Serenity House Communities.
And my name's Darci Pickett. I am Community Development Manager for Serenity House Communities.
So Serenity House Communities is a recovery community organization, and we support people who are in recovery from substance use disorder, codependency, and trauma.
We provide so many services. We do rides to recovery, so we will pick you up if you need to go to the grocery store, core therapy if you need to drop. We do peer recovery coaching, which is amazing because it's someone who's made it out of the darkness and they can help guide you through recovery. They're a person in long-term recovery, and the participants, that's one of our biggest services. They don't feel judged, they feel understood. They'll help them with resources and navigating the system. We do women's self-care support groups, men's support groups, youth support groups, lots of free community events, sober socials. We have our offer motherhood and recovery, so we do doula support services, birthing and breastfeeding classes, and we have a lot of community partnerships where we do community resource tables also.
And we also have a peer overdose response team that we recently developed with a grant from the Michigan Department of Health and Human Services. We will meet people where they're at after an overdose, post-overdose, and we'll meet families, we'll meet the person who experienced the overdose within 24 to 72 hours, and we'll provide self-care items, testing strips, Narcan that they can use if they decide to continue using. So we will meet people without judgment.
And I know we talked about too, Tara, it's also any substance use crises. So if they're withdrawing, detoxing, even they want to reach out to finally receive help, we're there for every step along their journey in recovery.
The Motherhood and Recovery program, I developed it after being a mom who experienced postpartum depression and a undiagnosed substance use disorder with co-occurring. That was many years ago, and through my pain, I turned it into purpose. And when this grant opportunity came about, I jumped right on it. And I knew I needed to help mothers who are also struggling. The stigma with mothers is still very much strong, and we want to help to curb that stigma by being that face and voice for recovery, as we are mothers in recovery, and we know that what's on the other side is incredible. We have 3 locations. So we have our Flint location, we have our Lapeer location, and we are building a location in Shiawassee County. So each one of those has its own website. So www.flintserenityhouse.org is our main site here. And then we have www.lapeerserenityhouse.org. And then we have Owasso's location, www.owassoserenityhouse.org. And our main line is 810-336-1018.
Next, we visit Hancharick Chiropractic Neurology Group in Grand Blanc, a place where cutting-edge technology meets heartfelt care. Led by Dr. Christine Hancharick, this urban retreat offers advanced treatment like non-surgical spinal decompression and chiropractic neurology, all tailored to help patients find lasting relief and renewed vitality. With a focus on treating the whole person, their team is redefining what healthcare can feel like. Let's take a closer look inside.
My name is Dr. Christine Hancharick, and I'm the owner of Hancharick Chiropractic Neurology Group. I've been a chiropractor in the Flint and Grand Blanc area for the last 22 years. Most patients come into the office because they're suffering from the classic traditional neck pain, back pain. Probably the biggest one that you hear about all day, every day is sciatic nerve pain. And the second most common thing that I see is headaches. That's when patients usually start with chiropractic. When you come to our office, obviously you're greeted with the most wonderful person at the front desk named Kelly. From there, we go ahead and do an extensive consultation with the patient, examination, a neurological, orthopedic, and a chiropractic exam then takes place, and then after that, any necessary x-rays. We take the x-rays and actually analyze them and see what is happening with the patient and discuss it with the other doctors in the clinic to find out what the best course of treatment or action may be. Our clinic is really specific as far as doing neurology. That's what sets us apart from anybody else actually in the Genesee County area. We practice with a neurology-based approach. So therefore, it takes us a little bit more time to analyze and figure out what's going on with the patient. We're also located in Grand Blanc in the Grand Ridge Galleria, which is right across from the Trillium Cinema that everyone's familiar with. Our address is 8185 Holly Road in Grand Blanc, Michigan.
As we draw to a close on today's NBC25 Health Special, we want to thank all of our guests for sharing their stories and expertise. And thank you, our viewers, for joining us on this journey through Mid-Michigan's vibrant health and wellness community. From Genesee Health Systems' innovative approach to crisis response, to the frontline dedication of Patriot Ambulance Service, to the holistic hearing and peer-led support at Serenity House Communities, to the advanced rehab technologies and compassionate care at Blue Sky Therapy Services, each segment has highlighted the powerful impact of people helping people. A special thank you to our sponsors for making this program possible. For more information on today's topics and featured providers, visit Mid-MichiganNow.com. Thank you for watching NBC25 Health Special. Until next time, Stay informed, stay inspired, and stay healthy, Mid-Michigan.